Okay, good morning. I'm just going to wait for a few more minutes to see if anybody else is going to check in. I will be starting the meeting in a few minutes. Okay, I'm going to get started with the meeting now. Welcome, whoever tunes in to this recording in the future. This is the Union Station Homeless Services 2015 Medical Insurance Open Enrollment meeting. I want to specify that this is only for medical insurance, your dental and vision insurance, as well as your chiropractic and acupuncture coverage will renew January 1st. So we will be having another one of these meetings to discuss those products, those lines of coverage. Today it's only medical insurance, okay? That being said, I'll go ahead and get this meeting going. All right, so first of all, we want to introduce ourselves. My name is Guillermo Gonzalez of Arroyo Insurance Services. We are your new health insurance brokers, and you can think of us as a second line of coverage or a resource, rather. When you hit a wall with the insurance companies and you've called regarding a claim or a billing issue, and you go to HR, we are there to help. So you can think of us as an extension of the HR department. We can assist you year-round, not just the open enrollment period. With that being said, August is the open enrollment period for our medical insurance plan. And in this meeting, I'm going to review the plan. And well, if anyone was ever, you can ask me questions regarding your specific situation. Okay. Okay, so this is what you need to know is that Union Station Homeless Services is proud to be able to provide a very high quality of benefits, and this is something that they're continuing to provide this year. The medical insurance premiums are only getting more expensive, and what we're seeing as a trend is employers are actually scaling back coverage, increasing copays, increasing out-of-pocket expenses for their employees. And this is just not something that Union Station is doing. So you're very fortunate because they are sponsoring this program, and it's a really rich program. So just wanted to add that in there for your reference. California Choice is a private exchange model that allows us to offer health net plans alongside Kaiser. And we're going to continue to do that this year. But there are a few plan offering changes. I'm going to go through those. Okay, what is changing and what is staying the same? So Union Station full-time eligible employees and part-time employees can select a medical insurance plan sharing the cost with the employer, okay? So part-time employees are considered 20 to 29 hours. Full-time employees are considered 30 hours or more a week. This is what's changing effective September 1st. Kaiser Permanente and HealthNet are still going to be the providers, but previously Union Station had offered up to 19 different medical insurance plan options. We looked at the enrollment status, and there's only about 6 plans that are being utilized. So all the plans that every employee is on right now are the one that are going to be renewed, and those are going to be the ones that are offered next year. The 13 plans that employees are not enrolled on will no longer be offered. These are the plans that are being offered effective September 1st. The Kaiser HMO 40 is your base plan. So that's going to be this one right here. And then the HealthNet HMO 40 is also your base plan. And these are $40 copays that I'll be going over in the benefit summary, but you have buy-up options as well as a buy-down option. So you have the Kaiser HMO 25 option, which is a lower copay, lower out-of-pocket expenses, but you will pay the difference between the premium of the buy-up plan and the premium of the base plan. HealthNet 25 is another buy-up option with lower copays, lower out-of-pocket expenses, but again, you will pay the difference between the buy-up plan's premium and the base plan's premium, okay? The HealthNet HMO 40 value works as a buy-down option, and the reason why it's a buy-down option is because the rates are lower on this plan. So it allows you to more cost efficiently add dependents and spouses. So that's one to take a look at if you're considering adding your family. And then we have a HealthNet PPO option, the HealthNet PPO 1500, which I'll be going through in detail. These are the medical insurance plans that are no longer offered. Medical insurance base plans. Okay, so base plans effective September 1st, 2015 are going to be, again, Kaiser Permanente HMO 40, HealthNet HMO 40. Okay. And these are the buy-up plan options: Kaiser Permanente 25, HealthNet Silver HMO 25, HealthNet PPO 1500. The buy-down option is HealthNet Silver HMO 40 value, which has a lower dependent rate. So if you're considering adding your dependents, this would be a good plan to have a cost-efficient option to do that. The employer contribution for full-time employees is going to be that Union Station pays the base plan premium minus $40 a month. That $40 a month is what you pay out of your payroll, pre-tax. So the example we give is that if the base premium is $592.15 a month, the employee pays $40 a month, the employer pays $552.15 a month. And this is the employer contribution for part-time employees, 20 to 29 hours a week. So Union Station is going to take 50% of the employer contribution rate that they provide a full-time employee, then add $40 to that, and that's what the part-time employee will contribute. So the example here is if the employer paid $552.12 for a full-time employee, you would cut that in half, which is $276.06, and then add $40. So the employee ends up paying $316.06 a month, and the employer ends up paying $276.09 a month. This is for part-time employees, 20 to 29 hours a week. And this brings up our slide about what's really making medical insurance so expensive. And I'm sure it's a question that comes up often because, medical insurance rates are really high. So the cost of delivering medical care actually increases 5 to 10% every year. 5 to 10% every year. So I'm just going to go ahead and mute because I'm hearing an echo. So let me just go ahead and do that right now. Okay. So as I was saying, that the cost of medical care increases 5 to 10% every year. This is due to prescription drugs. You know what? I'm hearing an echo. Can we all just mute? Let's see if we can mute. There we go. Okay, not hearing an echo anymore. Okay. Sorry about that. Okay, so the increased cost of delivering medical care increases 5 to 10% every year. And this is due to new prescription drugs and diagnostic technologies. Everyone wants the latest and the greatest in high-tech imaging services and prescription drugs, brand name medication. It's also increased life expectancy. So that's a good thing that we're living longer, but it's also costing a little bit more to keep us alive. The cost of labor, hospitals, medical centers, nurses, doctors, they all want to get paid well. The utilization of your plan, this is the way we consume care. And I'm going to get into this more when I review the benefits, but basically it's an incentive to be savvy consumers of our medical insurance. And then the Affordable Care Act, also known as Obamacare, instituted taxes and fees and federal compliance requirements that add an additional 6 to 8% to premium costs. Okay, so managing the costs. So your role is responsible utilization and healthy diet and exercise. So responsible utilization just means that to know when to go to the emergency room or the urgent care center. The urgent care center will treat you just as well as the emergency room will. To take advantage of preventative care visits, which are no charge to you, to prevent larger claims down the road. You know, what this looks like for you is that your employer is going to be able to provide allowances to cover premiums for a much longer time if we all work as a group to keep claims down. So this is what we're going to need from you. August is your open enrollment period, and right now is the time to make any changes. Adding, removing dependents needs to be done right now. You have until August 21st to do so. I'm going to get into that in the next slide, but if you are not on the plan and have satisfied your waiting period, right now is the time to enroll. Okay. If an employee wishes to decline employer-provided insurance, okay, if you have coverage to a spouse, we will still need a waiver of medical coverage from you, which is just, it's a sign application saying that you have coverage elsewhere. All right, the open enrollment window. That's going to be from yesterday, August 13th, 2015, until Friday, next Friday, a week from today, August 21st, 2015, okay? So the time to make any enrollment changes on any applications and turn it into us or turn it into HR is going to be August 13th through August 21st. You can only make benefit election changes for the coming plan year within these dates. What that means is that six months down the road, if you wanted to say add a spouse and you didn't do it now, other than a qualifying event, if you just got married, a new adoption, new birth, that would trigger coverage. But right now is the time to add a spouse if you'd like, or add a dependent or remove a dependent. And that will be effective throughout the plan year until next September. All right, so now I'm going to go through a summary of your medical benefits. So as I mentioned, you have two base plan options, the Kaiser HMO 40 and the HealthNet Silver HMO 40. Neither one has an individual deductible nor a family deductible. The individual out-of-pocket maximum is $3,000 on both plans. What this number represents is the maximum amount of money that you would spend in one calendar year. So as you will see that the copays are set very low so that it protects you from getting even close to hitting that amount. But if you have a really catastrophic year, that is the most that you would spend in one calendar year, okay? Family out-of-pocket maximum is $6,000 on both plans. So if you add spouse and dependents, the most that you would spend for all of them combined is $6,000 in a calendar year. Primary care office visits, it's a $40 copay on both plans. Specialist office visits is a $40 copay on both plans, but I want you to take a look at this. Preventative care visits are no charge, and that's an incentive rolled out by the Affordable Care Act. So for men, you get one physical for free a year. For women, you get a physical and a well woman exam for free every year. Okay, so we definitely encourage members to take advantage of that. You're not going to get charged anything, and it prevents larger claims, and it detects anything if there is anything wrong very early. Okay, there is chiropractic and acupuncture care available, which is the copays are set at chiropractic $30 copay per visit and acupuncture at $55 copay per visit. X-ray and lab procedures are set at $10 copays on both plans. MRI and high-tech services are set at $50 copay per procedure on both plans, okay? So now we're going to get into hospital service. If you are hospitalized on either of the base plans, you are going to pay a $500 copay per day. Now, I want you to take a look at something. Even if you're hospitalized for, say, 7 to 14 days, even if you're hospitalized for a month, the most you would pay is $500 times 6 days, because then you would hit your out-of-pocket maximum, okay? Outpatient surgery in a hospital, $250 copay per procedure on the Kaiser plan, but on the HealthNet plan, it's a $500 copay per procedure. An emergency room visit is a $150 copay per visit on the Kaiser plan and a $250 copay per visit on the HealthNet plan. I want you to take a look at the difference between the emergency room visit copay, which is $150, and the urgent care visit, which is $40, okay? So knowing the difference between these two, you know, we usually like using the rule that if you're not in fear of losing your life, if you're not short of breath or bleeding out, please go use their urgent care center, because they'll be able to treat you faster. It's going to cost you less, and they'll be able to provide the same treatment the emergency room would. The emergency room is really supposed to be just for patients that are in need of critical care immediately. And we say this because it will save you time and money. If you go to the emergency room and you are not in need of critical care immediately, you might end up waiting 4 to 6 hours. Okay. All right. So on the Health Net plan, it's $250 copay for emergency room, but just a $40 copay for the urgent care. With Kaiser, you can go to a Kaiser hospital and just say you need an urgent care center, and they will send you to an urgent care center. So anytime you see Kaiser, you can go to the Kaiser hospital. You can go and see a doctor there. That's the benefit with Kaiser. But the HealthNet HMO model, however, will have you designate a primary care physician. This primary care physician will have a medical group, such as healthcare partners. And when you see the medical group's urgent care centers, that's where you would go to. Okay. Very important that with the HealthNet HMO model, you have to stay within network in order to be reimbursed for services rendered. So anything that is out of network on an HMO will not be covered, other than a true emergency. Okay, so make sure that you are staying within network. But if you have an emergency and you're rushed to a hospital, they're going to go ahead and take care of the claim if it's a true emergency. Okay, so ambulance transport is $200 copay on both plans. Now we get down to the prescription drug copays. There is no annual prescription drug deductible on either plan. For Tier 1 generic 30-day supply, which is about 90% of all medication, falls under this tier. It's going to be a $15 copay on Kaiser and a $20 copay on HealthNet. Okay. Tier 2 brand name medication, 30-day supply. You have a $30 copay on Kaiser and a $35 copay on HealthNet. For Tier 3 non-formulary 30-day supply, this is going to be like newly patented medication. You can have a $30 copay with prior authorization required on Kaiser and a $50 copay on HealthNet. For Tier 4 specialty drugs, very rare drugs in this Tier 4, kind of some chemo medication and things of that nature are going to be in this tier. You can have a $30 copay on the Kaiser, no charge on the HealthNet. Okay. If you have a chronic condition and you take medication on a regular basis, we really recommend the mail order 90-day supply benefit. What this benefit does is it sends the medication directly to your home, a 90-day supply of it for 3-month supply, but you only pay a 2-month copay. Okay, so for Tier 1 generic 90-day supply, you'd pay a $30 copay. Okay, that's just twice the copay for a 30-day supply, and you get 90 days. Okay, so that's how that works. And you can let HR or you can let us know if you are interested in the mail order form. It's just a form that you have to fill out, providing your address and your prescription, and we can send that to the carrier on your behalf. Okay, so these are the base plans. Now I'm going to speak about the buy down plan option. Okay, and this plan is if you are interested in enrolling a dependent, a spouse. These rates are going to be the most affordable for you to do so. As you can see, there is no individual deductible. There is no family deductible. The individual out-of-pocket maximum is set at $4,500. This is the number that represents the most that you would spend in a calendar year. The family out-of-pocket maximum is $9,000. Okay, the most you would spend in a calendar year for your entire family. Primary care office visits are going to be $40 copay per visit. Specialist offices are going to be $40 copay per visit. As you can see, preventative care visits on all plans are now no charge. Chiropractic and acupuncture care are available. X-ray and lab procedures, the $10 copay per procedure. MRI and high-tech services, high-tech imaging, it's going to be a $50 copay per procedure. Hospital services, if you were to be hospitalized on this plan, you would pay 40% coinsurance. Now, what coinsurance is if the services rendered cost $1,000 and you have a 40% coinsurance, you would end up paying $400. Outpatient surgery in a hospital is 40% coinsurance, okay? So what that means is that you would pay 40% of the entire cost of the surgery up to your individual out-of-pocket maximum. Okay, so that's how you can kind of see how you can get close to reaching that individual out-of-pocket maximum with the co-insurance. Because if a surgery is $10,000 and you're paying 40%, that's going to be $4,000 out of pocket. Okay. Emergency room visit is a $250 copay per visit. Urgent care is always going to be lower at $50 copay per visit. Okay. We recommend that you find your urgent care, your in-network urgent care center before it happens, before the need to go to the urgent care happens. So what you can do is ask your primary care physician what urgent care center that they recommend, and they can lead you in the right direction. Ambulance rides are a $200 copay per transport. Okay. And on this plan, I want to point out something very important regarding the prescription drugs. Pardon me. Okay. There's a $250 deductible for prescription, brand name, and non-formulary and specialty drugs. Okay, so what this means, this $250 deductible, it means that if you are prescribed a brand name medication, anything from tiers 2 to 4, you would have to pay $250 out of pocket before you access these copays. So if you're prescribed generic medication, you only pay a $20 copay and you don't pay the $250. But if you were prescribed a tier 2 brand name medication, which by the way, you can request a generic substitute, but in the case that there isn't a generic substitute, you would have to come out of pocket $250, then pay the $40 copay. But once you meet this $250 deductible, you don't have to pay it for the rest of the year, and that is the calendar year. So it does reset January 1st. Okay. Non-formulary 30-day supply would be a $50 copay, and specialty drugs at no charge after $250 deductible is paid. Okay. The mail order benefit is also built in this plan, as it will be on all plans. Okay, now we're going to go into the buy-up plan options. Now, you're going to have a choice of the Kaiser HMO 25, the HealthNet Silver HMO 25, and I want you to pay attention on the copays on this one. Both of these plans have significantly lower copays, so you may be purchasing a monthly premium difference, right? But when you actually utilize coverage, it's going to be a lot less out of pocket, and I'll show you how. No individual deductibles or family deductibles on either plan. Individual out-of-pocket maximum set at $2,500 on the Kaiser plan, $2,500 on the HealthNet plan. Both have a $5,000 family out-of-pocket maximum. Primary care office visits, $25 copay instead of the $40 on both plans. Specialist office visit, $25 copay instead of $40 on both plans. Preventative care visits are at no charge. Chiro and Acu is available. I want you to take a look at this. The X-ray and lab procedures, the MRI and high-tech imaging services, there's no charge on either plan. Okay, so just right there, you're not paying a copay for that, and that's a pretty good thing. Hospital services. If you were to be hospitalized on either of these plans, you would pay a $500 copay per admission on the Kaiser. Now, what does per admission mean? So what that means is that if you're hospitalized and you stay in the hospital for a week, you only pay a $500 copay because you were admitted, and that's it. You don't pay per day. Okay. On the HealthNet plan, there is a $500 copay per day up to a 4-day max. Okay, so after the 5th day, you don't pay. Outpatient surgery in a hospital is $250 copay per procedure on the Kaiser plan and a $300 copay per procedure on the HealthNet plan. Emergency room visits, $150 copay per visit on the Kaiser plan, as well as in the HealthNet plan. Urgent care visit, $25 copay on both plans. Ambulance is going to be a $50 copay per transport on both plans, okay? Neither of these plans have a prescription drug deductible, and I'll go through the prescription drug copays on the Kaiser plan first. So generic is going to be $10 copay. Brand name is going to be $25 copay. Again, these are 30-day supplies. Non-formulary is going to be a $25 copay, but a prior authorization is required, as well as a tier 4, $25 copay, prior authorization required. Mail order is available on this plan as it is on all plans. Now let's take a look at the HealthNet copays for prescription drugs. $15 copay for generic, $25 copay for brand, $50 copay for non-formulary, and no charge for specialty drugs, okay? All right, now I'm going to review the PPO option you have available, okay? So in this option, $1,500 is your individual deductible, $4,000 per person is your individual out-of-pocket maximum, all right? And that applies to every member that's on this plan, okay? $40 copay per visit for a physician office visit, and I want to specify the difference between the PPO and the HMO models. The PPO, you can go to any doctor you want, no matter if they're in network or out of network. The PPO model has a wider network, has a larger network, and then even if you go to an out-of-network provider, there is an out-of-network reimbursement on the plan. On the HMO model, there is no out-of-network reimbursement, okay? So you can go to any doctor you want in the HealthNet PPO. This deductible, though, this $1,500 deductible, this means this is first dollar that comes out of your pocket before you can access the rest of the benefits, okay? And I'll show you how that looks like in a second. As you can see, there's deductibles waived on specialists and office visits for primary cares. There's no charge for preventative care. X-ray and lab procedures, 20% coinsurance after the deductible. So you'd have to meet that deductible first, pay $1,500 out of pocket first. Then you would pay 20% of the coinsurance. So again, if a service rendered is $100 and 20% coinsurance, you would pay $20 after you've met $1,500 deductible per person. Same goes for MRI and high-tech imaging services. If you were to be hospitalized on the PPO, you would pay a $250 copay. Then you would pay a 20% coinsurance after deductible. Same goes for surgery, $250 copay, then a 20% coinsurance after deductible. An emergency room visit would be 20% coinsurance after deductible, as well as an urgent care visit, okay? Ambulance ride would be a $50 copay, then 20% coinsurance after deductible, okay? So as you can see, the PPO model is going to be a little bit pricier in terms of premium that you pay per month and out-of-pocket expenses. So we really recommend people consider that when electing a PPO plan, okay? The annual prescription drug deductible on this plan is $150. And again, if you get brand, non-formulary, or specialty drugs, you will have to come out of pocket $150 before you are able to access the copay. So for generic, $10 copay, there's no deductible that applies, but for brand name, you pay $150, and then after that, $20 copay. That $150 only has to be met once a year for tiers 2 through 4 combined. Non-formulary, 30-day supply is a $35 copay. Specialty drug is a $40 copay, okay? The mail order prescription drug benefit is built into this plan as well. So this is how to find a provider. You go to calchoiceplus.com, click on doctor search, provider search. You would pull down the drop-down menu that has the Kaiser plan or the HealthNet plan that you are on. And remember that this really applies mostly for the HMOs, and specifically for the HealthNet HMO, because in the Kaiser model, you can go to any Kaiser doctor, okay? But in the HealthNet HMO, you have to go to a doctor that is specifically in the network of HealthNet, and it's not as obvious as Kaiser. You know, you go to a Kaiser hospital, everyone there works for Kaiser and is a Kaiser doctor. But with the HealthNet HMO, you really have to take a look at what doctor is in the network, and you have to verify that, okay? Again, on the PPO, you can go to any doctor you want, okay? And since we are only reviewing medical insurance today, that concludes my presentation, okay? If there's any questions, please feel free to ask HR, and if HR can't answer, we are going to be there to help you out, okay? So remember us as an extension of the HR department and a kind of an additional resource between you and the insurance carriers, okay? Again, my name is Guillermo, and we are Royal Insurance Services, and we thank you for attending this meeting. So I'm going to go ahead and unmute everybody, and if there's any questions, please feel free. If there's any questions, please feel free. Okay, I'm going to go ahead and conclude this meeting. It has been recorded, so it will be available for you to watch via web link. Okay, have a great weekend, everybody. Thanks again. Bye-bye.